Good morning. Welcome to CMS for all you who could make it out today. We intended on doing this conference in October, but because of the government shutdown, we weren't able to do that. So here we are, and when we picked, January 31st, it was like, oh boy, weather. So I'm really happy we had good weather, and we can have a auditorium full of people here today. And welcome to, I think there's lots of folks on the line virtually as usual in all these types of conferences, to welcome to all of you too. So we had a conference back in May, and after that conference we did a survey and took a pulse of the audience we had at the time, to try, because that was our first conference, tried to figure out what it was that you all want. These conferences are for you, our contracting community. Contractors at CMS kind of help, they're the engine that kind of helps the agency run. I always tell people we have about 5,000 federal employees, around 80,000 contractor employees. So the work you all do is very, very important. So we want to make this kind of conference meaningful to you. So we've done some things here today to try to make that meaningful. So what do we have on tap for you today? In the morning, from now till about 10:30, you'll hear from a few guest speakers. Some of my staff and program staff will talk to you a little bit about the opportunities that we have coming up throughout this year and into the future, so you can kind of start doing some research into some of the areas that you might be interested in. You all wanted to hear a little bit more about some program manager perspectives, so we're going to have 4 breakout sessions, as you can see from the agenda. In session, some opinions and views on what works well and what doesn't work well when it comes to writing proposals, because we know you all spend a lot of time thinking about that. There's some good news stories that you'll hear from contractors in a session this afternoon. We're going to be talking about past performance, be talking about doing business with CMS. So we have these 4 sessions. As you know, we'll have a break time here, and a lunchtime, then a break this afternoon. So as you probably all have already seen out in the hallway here, something that you all wanted, we have some tables of some of our large businesses that currently do business with CMS that are looking for maybe some subcontractors that they can partner with. We have the Small Business Administration out there, and we have a host of organizations that you can visit that hopefully can provide you some good information and insight into doing business with CMS and the government in general. The cafeteria is on the lower level. For those of you who don't know, there's a coffee bar down there open all the time. I've been told that they're having trouble at the cafeteria with their credit card program, so if you have cash, to use cash, so that'll make things move along a little quicker. We have plenty of places outside the gate here that you can go to, right outside, close to the building we're in, 7111 Security Boulevard, and around, so we have an hour set aside for that. Restrooms you passed on the way in, they're down the hallway as you're coming in on the right-hand side, if you haven't found them yet. So outside, as I mentioned, we have the National Contract Management Association, which my staff is a part of. A lot of my staff belong to that. That's a good organization where we kind of learn from industry and they learn from us. We've just kind of gotten started a chapter, so any of you are interested in that local chapter, talk to them. The Small Business Administration is out there for your small businesses. Defense Contract Audit Agency, there are some of our eyes and ears on the ground when it comes to audit type of work. General Services Administration, we do, I don't know, around about $1 billion a year in GSA type of work, so it'd be good to hear from them. And then there's a list of some of our companies that I mentioned there that you can see up on the screen that you could stop by and talk to about their experiences. Also, there, like we did last time, there'll be a survey. Again, please take the time to do that survey. We'll be emailing you that survey. Your feedback is important, so the next time we do one of these, be frank in your survey. Tell us what you like, what you don't like, what you'd like to hear, what was useful, what wasn't. We do take a lot of stock in that survey. The presentations for today will be available on the CMS website, the external website. So for those of you who want to get copies of that, they're out there for you to see. So who OAGM is only 200 and some people within 5,000. Who are we? Sort of what do we do? We provide, as it says on the slide, we're a mission-critical component to help the agency get their work done, negotiating and administering hundreds of contracts, grants, and interagency agreements. This past year, we did just hit the $10 billion mark. So you can see here just sort of what our volume of dollars is as far as the breakdown, contract, grants, and interagency agreements, about $5.7 billion in contracts. The grant workload is growing tremendously. And then our interagency agreements, which sometimes turn into contracts at other agencies, but mostly for other support from other federal agencies. Just as sort of a graph that depicts the growth just between FY12 and FY13, the dollar volume, even though you hear there's budget cuts, CMS has a lot of different funding streams, a lot of different specialized budgets to support certain programs. So our budget has grown. And the dollars grew 19% from FY12 to FY13. And then actions. So dollars are one thing, contract actions are another thing. There's small actions and large actions. One large action might be a year-long competitive procurement. Another action might be a simplified acquisition or a modification to change a project officer or something like that. But either way, there's 6,000 actions that we do every year. So we have a high volume of actions, as you can see, and then the growth in those actions has increased from last year to this year about 25%. So just to kind of give you a flavor of sort of the actions and dollars that we have here at CMS. We are committed to small business. As you can see from the chart, last year I kept telling Claude, our SBA rep, and others in the department that we're not going to meet our goals, which was, I think, 22%, and somehow or another, working with the small businesses and you all and my staff, contracting officers, we were able to do that. So last year we did over $1 billion worth of business to our small businesses. Our small businesses are important to us. We spend a lot of time thinking about what work small businesses can do, and we take that very seriously for any of the small businesses that have done business with us, and we'll continue to try. If I had, again, I've had to make a prediction like I did last year, I'd say we might not meet our goal, but I don't want to say that. I'd be wrong twice in a row. So, you know, probably this year we'll do around $1 billion also in work with small business. So just, you know, CMS, I always like to remind folks what our vision and what our mission is at OAGM as part of the bigger CMS. And what we do is we partner with stakeholders to deliver best value acquisition grants and interagency agreement solutions to promote high quality and care and services to the people we serve, the 100 million almost now consumers, beneficiaries in Medicare, Medicaid, in our program, social program. And our vision is to be the best-in-class acquisition and grants management organization. We strive to be the best as an organization. Our core values, and I only show you this because one of our core values is transparency. So that is with you, we want to be transparent about what we're doing. We want to let you know as much as we can, as quick as we can, so that you can do good planning to put yourself in the right position to provide, again, good value contracting services to CMS. So this is sort of a list of what our core values are. So that's all I have. Hopefully you'll enjoy the show. I'll be around hopefully to meet some of you throughout the day. So our next speaker up is Angela Billups. Angela is the Senior Procurement Representative at the department level of HHS. She has a big job. I don't know, it's over 1,000 contracting professionals throughout HHS that she has responsibility for in the policy and program areas. So she's going to share with you today some of her vision and some of her thoughts. Angela?
Good morning, everyone. I actually have the contracting piece, the 1102s, I have the program managers, as well as the contracting officers in my area of responsibility as the Senior Procurement Executive at HHS. And I'm glad to be here this morning to have this opportunity to speak with you all, and hopefully there's a good group of mixture of people here today. from industry as well as within CMS. So I thank you very much for the opportunity, Dan. And basically, because this is an industry forum, I had provided for Maine some things that I was going to talk about, but I'm going to kind of adjust that a little bit. I wasn't really sure that it was an industry forum until yesterday. Because I asked her a question and I asked the wrong question, I got the right answer to the question that I asked. So that's kind of what what caused the confusion. But we're all on the same sheet of music right now. So Maine and I talked this late. I didn't leave the office until about 7 last night, and I said, oh, I need to ask her one more question. So based on getting that answer to that question, I think I'm ready to speak about some of the things I need that will be able to help you, because this really is about you. It's not about me. So I wanted to kind of start this conversation out about just telling you about a couple of things that I've just done this week as it relates to industry and our contractors, as well as the contracting workforce from an industry perspective as well as from a federal perspective, because I had an opportunity this week to go to be a guest speaker at the professional services group, where they had the chairman of the Acquisition Reform Committee, congressperson that was in charge of that, and he talked about a couple of things that they're looking at as far as reforming acquisition, because we're at a place now that the last time acquisition was reformed was in 1996. So it has been a while since we've looked at it to do the acquisition reform, to relook at the federal acquisition regulation. There are some legislative areas in the federal acquisition regulation that is causing some of the challenges that we have with the acquisition process. So I just wanted to kind of give you the benefit of some of the things that I heard being at that meeting, so, and it may be some of the things that are on your mind. But one of the things that was talked about was what they're going to do with the committee this time. They're going to look at the federal acquisition regulation. Now, all of us know that nothing in the federal government moves very fast. So we are talking about ideas, and then hopefully, some of these things I think they will fast track, others may take some time. But basically, one of the things that the chairperson asked of the industry group there, the meeting that I went to was an invitee only. There were several CEOs around the country that was invited to this meeting. It was probably a total of about 50 or 60 CEOs from various companies, and they did have a mixture of groups of people, small and large businesses. And basically, what they were talking about is just, like I said, those areas where there may be some legislative relief to some of the challenges that we have. But then, in addition to that, questions came up from the group talking about are there areas where the government is moving too far when it comes to inherently governmental, and that industry may have more experience in certain areas, so that it would be better for industry to do these functions rather than the government to do those functions? Now, at this forum, we didn't answer any questions. We just had the questions, and I'm giving you the benefit of some of the questions that was asked, which may be some of the questions that resonate with some of the issues that you have. And also, at that same forum, questions were asked about how, as the federal government, with all of the ways that we supplement the federal acquisition regulation at each of the federal departments, and whether or not that will be something that will be looked at, so that you as contractors looking at the federal acquisition regulation, when you go to DOD, you do contracting one way. When you go to HHS, you do contracting another way. These are all some of the things that they were talking about, and I'm sure some of the things that you would like for us to do something about. And I just wanted to let you know those are things that we are discussing. The other meeting that I went to this week was at OFPP, talking about just our acquisition workforce and some of the challenges that we have with the acquisition workforce, so that we can make sure that we have our acquisition workforce be as professional as they can be, get them the right training that they need, and then look for different ways so that we can make sure that we're doing what we need to do internal to the government, as well as helping you as the contractors to understand all those various roles. So some of the things that we're going to do at HHS to kind of address that, because like I said from the beginning, as a senior procurement executive, I am responsible for the entire acquisition community at HHS. That includes the program managers, the contracting officer representatives, as well as those people in the 1102 series, who are our contracting professionals, and basically the business advisors to those PMs as well as those CORs. So some of the things that I'm going to do at HHS this year, one of the things that I'm going to do, and I have my staff poised to kind of start this off, is this year I'm really looking at whatever area we're working in. I'm looking for results. There's a time and a place for process and procedures, but then sometimes you can get so caught up on process and procedures and you really don't get a result. And that is the reason why some of the questions that I was, as the speaker at the PSC meeting earlier this week, from the contractors, I received questions such as, it appears to us that the program manager and the contracting officers don't get along or they don't talk. Now that question I got from the CEOs. And basically what they were asking me is that a true statement? And of course I had to answer yes. It is a true statement. In some cases, we are finding, rather than those two groups of people being integrated, the PM go off and do whatever it is that they need to do to develop a requirement, and then after they develop that requirement, they throw it over the wall to the contracting professionals, and then sometimes the two may get together during the process, and other times it just kind of happen in silos. So that is something that we're going to work on. The other question that was asked by the CEOs in reference to the contracting process is the communication even with industry, because they don't feel like we are, even though we have vendor communications plans out there and things of that nature, they really don't feel like we're communicating as much as we can. Now let me tell you how I have to balance that question. There are a lot of things. One of the things that's happening here today at CMS, it is an industry forum. Some of our operating divisions within HHS, they do not have industry forums. But all of these things take time. And then when you balance the industry forum with the work that has to be done and all of those things, it's the same people putting together the industry forum, doing, awarding contracts. So what we have to do is make sure that we try to do some of these things, but it is not going to be an area when it comes to everybody having an opportunity to have a FaceTime with the contracting officer, or everybody having an opportunity to have some FaceTime with the contract specialist, or even the program manager. So I applaud Dan for having this industry day, because sometimes that would be the best way for you to spend some time at our operating divisions within HHS so that you can get those issues that are important to you out on the table so that people can understand. But I also want to let you know we do have a vendor communications plan at HHS. You can go to the Federal Business Opportunity page, and when you click on the Federal Business Opportunity page, there's an area there for the federal vendor communications plan for each of the departments, and HHS plan is posted on the Federal Business Opportunity page. And I can tell you that I know that Dan takes his time to meet with vendors when he can, when he has the time, because there have been times when special groups have come to me and said, I need to be able to speak with so-and-so about this issue. When they come to me and tell me what the issue is, and I think one of the heads of the contracting activities can help with that, one of the things that I do, I personally call the HCA and say, will you take some time and meet with them? Here's the reason why I need for you to meet with them, and they do that. So what I'm saying to you is we do what we can with the resources that we have, but in a lot of cases, it's a whole lot more of you than it is of us. So what we ask for you to do is just have some patience, and we do try to do what we can to support you in that area. One of the other things that was talked about is there is apparently in the vendor community is something that notionally I had an idea about, simply because of I have contractors that work for my office, but one of the things that came up is that some of the incumbent contractors are not winning new competitions now. And so for some reason, they're feeling like the government has kind of crusade to get rid of incumbents and get new contractors in. That was a big topic of conversation at the meeting that I went to on Monday. And they had Bloomberg government to do a study to see if that perception from industry, if it is a correct perception. The results of the study was about 50-50. With the new contracts that are being competed, some of them are winning, and then others they're not. But there are a lot of things that feed into that. And one of the things that I want to say to you, as mostly contractors trying to do business with the government, one of the things that we all have to understand, the program that you had 5 years ago, and because of the budgets and other things that are going on in the government, it is not the same program. But when you take the proposal that you gave us the last time we competed it, and you take that proposal and dust it off and send it to us again, the chances of you getting that award are slim and none. Because, because you haven't taken the time to really look at what's going on in the government today. And sometimes I think contractors take for granted, I've been the one doing this program for the government for 15 years. I can tell you an experience that I had in my office when I first went to HHS. And I was probably there for about a year, and as of today, I've been there 3 years as a senior procurement executive. But I was probably there for about a year, and I had a contract that was not working well. The program manager was coming to me and telling me different things. The COR was telling me. And so one day I just said, you know what, I've had enough. We're going to stop work on this contract, which is what I did. But probably about 3 days after I stopped work on the contract, I got a letter. This is what this contractor did. I got a letter from the contractor, and the contractor commenced to tell me, I have been running this program at HHS for 15 years. You do not know what you're doing. I know what I'm doing, and you will turn my contract back on because without me, your program will not succeed. I am not kidding you. I can show you the letter. I still have it, okay? And I just looked at that and I said, wow. But needless to say, I didn't turn the contract back on. It took me probably about 8 months to get a new contractor. And everything the contractor thought he was doing for me, I had enough skills to do it myself. So now I'm questioning, why am I paying a contractor to do something that I can do? So all I'm saying is, we all have to work together. We need contractors. It is not like we're on opposite sides of this thing. We need contractors. We need you to be there to help us in those areas where we have the contracts. But what we want everybody to bring their A game. And not only do we want you to bring your A game, we want all of us to communicate so that we can be all on one team and doing the one thing that we do here at CMS, and that is the mission of supporting the Medicaid and Medicare programs, which is important to the Americans in this country. It is very important, but we need for everybody to bring their best when they come to the table. Thank you.
Good morning. My name is Derek Hurd. I am the Deputy Director for the Office of Acquisition and Grants Management. Glad to have you here this morning. Just wanted to talk to you a little bit about some business opportunities we have here at OAGM. We have put up our FY 2014 acquisition forecast for you, and we have that at one of our external links so that you will be able to go in, pull up that forecast, and look at some of the business opportunities that we have. As you can see, you will just click on the CMS FY 2014 Industry Day link, and that link will take you right into the forecast for us. And so what we wanted to do today is talk to you about some useful information that will be on the forecast. We have close to 160 different competitive actions that will be up on that forecast. We will provide the primary NAIC code for you, the type of competition, whether it's a recompete or whether it's a new competition, the type of action, whether it's GSA schedule or is it a GWAC, 8A competitive, full and open. The estimated dollar value will give you a range for those specific actions that we have up there. And you also have the point of contact information. You'll have the contracting officer, their email address for those opportunities. We will also provide the request for proposal date, the estimated time frame when we plan on releasing the solicitation, and the estimated target award date. And those will be just some helpful information. There'll be additional information in the field when you click on that link. In addition to that, we are in the process of updating our IDIQ list for our internal IDIQ umbrella contracts that we have in OAGM. And that information will be available at the same web link. It should be up in about a week or so. We are constantly trying to keep that up to date so that you have the most current information. So you'll be able to access that shortly, and you'll be able to go in the same way that you go into getting to the forecast. And then this slide shows a sample of some of our internal IDIQ contracts that we have available to you from all the different program areas that we're working in. And these are some of the major ones. We have our virtual data center, our enterprise systems development, our program safeguard contracts, our ZPICs, our zone program integrity contracts. I know many of you are interested in the recompete opportunity for ESD2, and Andy Mummert, one of our managers here, will talk a little bit about that opportunity when he comes up. And also, we'll have our list of our prime contractors for each of the IDIQ vehicles that we have up here, and as well as their point of contact information. I encourage you to use that information for subcontracting opportunities with them for requirements as they come out under each one of these vehicles. And with that being said, I'm going to be brief this morning so we can get to our program officials and some of our managers here in OAGM that will give you some more information on a little bit more detail of some of the programs that we service, some of the requirements, and a little detail about some upcoming potential actions for you. And so now I would like to introduce Linda Hook. She is our director for the Medicare Administrative Contracts Group. Thank you.
Forward. Okay. Thanks, Derek. As Derek said, I'm Linda Hook, and I'm the director of the Medicare Administrative Contracts Group in OAGM. And my group supports the Medicare Contractor Management Group in the Center for Medicare through the award of and administration of the Medicare Administrative Contracts, or we like to call them the MACs. So the MAC contractors provide health insurance benefits, administration services, including Medicare claims processing, and payment services in support of the Medicare fee-for-service program. CMS relies on a network of MAC contractors to process the Medicare claims. They serve as the primary operational contact between the Medicare fee-for-service program and the 1.5 million healthcare providers. They process nearly 4.9 million Medicare claims every business day. And they also disperse more than $365 billion annually in program payments. So the MAC contracts are awarded through full and open competition, and they are cost-plus award fee type contracts. They are awarded for a period of 1 year with 4 one-year option periods, and they all opportunities for every competition that we post are done through FedBizOpps so that everyone has an opportunity to see those. So if you're a small business here today, what I would recommend is that if you have an interest in subcontracting on these large contracts, that you reach out to the current contractors for any opportunities that may exist. And I would recommend that you do that before we release solicitations this year. So with me today, I've asked my program representative to join me. So Larry Young is the acting director of the Medicare Contractor Management Group. And I've asked him to come today to speak a little bit more about the MAC program and also to share with you some of the procurement activities that we have going on this fiscal year. So here it is. Forward, backward.
Oh, so simple. Okay, great. So thank you, Linda, for having us here. I wanted to ask first, is anybody from Dunkin' Donuts here? No? Okay. I have this kind of perverse idea that we send out these MAC contract proposals and we'll get one from Dunkin' Donuts one year, but it hasn't happened yet. So let's see if I can work this. Real quickly, I thought I would talk a little bit about, elaborate a little bit about what the MACs do necessarily, for those of you who don't have any information about it. As Linda mentioned, they process claims. She gave you a good idea of the scope. It comes out to about 1.2 billion claims a year, 1.1, 1.2, in between. When you get up in the billions, we get it gets a little gray. They also do a number of diverse things for us. Claims payments, one of the primary core things they do as far as making Medicare claims payments. They adjudicate first-level appeals for us. They handle provider customer service inquiries as opposed to beneficiary service inquiries. They handle hospital cost and audit reports for us. They handle the integration of IT systems changes that go on throughout the program. There's a fairly complex process we go through as far as doing change management. It involves a number of different entities. The MACs help us test those on the back end. So my point is it's the core backbone of the Medicare program in terms of the basic claims payment that's provided, but they also do a number of diverse and a variety of things. So there's some probably some opportunities there for many of you, if you're not already a MAC, if you're perhaps interested in associating with them to help them augment their services, that's perhaps a possibility for you. So let's go through real quickly. I was going to just talk about the jurisdictions. This is the current landscape for the Medicare Administrative MAC program. We've got basically 12 MAC jurisdictions right now, some of the MAC contracts are held by the same company, as you can see. So if you start in the West, Meridian, which is located in Fargo, headquartered in Fargo, North Dakota, they have most of the West. WPS is Wisconsin Physician Services. Novitas is, they also have JH and JL. You'll notice they're headquartered in Mechanicsburg, Pennsylvania, but they're a sibling company of Diversified Service Options, which is a holding company in Florida. And there is, NGS is National Government Services. They have also more than one contract with us. They're in Indianapolis. Cigna is on there, and it's a little outdated. My folks got these maps updated and missed this. It used to be Cigna, but it's now CGS. They've become part of the Solarian Group, which is part of Blue Cross and Blue Shield South Carolina, actually. And then Palmetto, J11, is also part of Blue Cross Blue Shield South Carolina subsidiary. And then finally First Coast, which has Florida, and they also have Puerto Rico and the U.S. Virgin Islands. So if you want to do some specialty work where it's tropical, unlike here, there's your opportunity. Let's go to another map. These are the jurisdictions that we eventually will get to. We'll be consolidating some jurisdictions as we move forward. We have done that already with some of these, but this is the eventual map that we're working towards in the long run. Just to talk about, let me see if the next one I think has yeah, there we go. that's the final. You notice we changed between, we love going back and forth between numbers and letters, so we've stuck with letters for the final. This is how things will look like in the long run. The upcoming procurements that you might want to focus on and look for in FedBizOps, there's procurement for jurisdiction M. That's it was J11 on the other map. That's the currently held by Palmetto. That RFP we hope to have out sometime in the second quarter this year, May, June. Jurisdiction B, which is a DME MAC contract, which I don't have a map on here up here, but it's inclusive of the central north states, up in Michigan, Indiana, Ohio, Illinois. I'm not going to remember them all off the top of my head. And then there was one other one we have coming up. Let me remember. Yes, JI, which is going to be a consolidation of J15 and J8. So it's that yellow one right there in the middle. That one we hope to have out in sometime in the summer, the RFP out in FedBizOps. So you can look for that. And with that, I think that's your overview of the MAC program. I now get to introduce to you Ed Hughes, Director of Acquisitions and Grants Group.
Again, good morning. My name is Ed Hughes, and I'm the Director of the Acquisition and Grants Group within CMS. We have one of the 4 operating groups within the acquisition area. I guess it's important for you to know that in looking at the numbers that you were given earlier, we have obligated in this past year probably 1/3 of the contracting dollars, and obviously 100% of all the grant dollars. I think it's important for you to note that in the past year, although this is a contracting session, we have had obligated over $3.2 billion in grants this year and about $3.5 billion in grants the previous year. So it's not that we're changing our mission or anything of that nature. It's just the fact that the grants have become very important to us, and that's a different way of achieving the vision and the results that we need within CMS. My goal today with this meeting is communicating with you so that you can contract with us. As Dan has indicated, there are 80,000 contract employees out there that are going to help and have been helping CMS achieve its mission. That has got to continue, otherwise we can't achieve our mission. So it's very important, and I'm very happy that you're all here today to hear the mission, hear about our mission, and to communicate with us so that we can communicate with you so you can know, so we can all make it work. I want to spend a moment talking about the work my group does in addition to the grants, so you can think about matching your skill sets to my area. Within my group, we have several large programs, and we support a variety of contracting vehicles. We have the 1-800 Medicare. We have the call center support contracts. We have the beneficiary outreach contracts. Obviously, we just spoke previously about our grant endeavors to support the Innovation Center. We have research and evaluation efforts to support the Affordable Care Act. We also have contracts for facilities and human capital to fill our internal agency needs. And I guess the reality of what I'm talking about here is the fact that there are probably 17 or 18 components at any given time within CMS, and my group supports 14 of those in their contracting efforts. So we run the gamut in terms of the types of contracting we do and the dollars that we award to support those efforts. I think it's important to note, and I think this was obvious, this was kind of presented already, is the fact that we have a lot of developed contracting vehicles in place. And I think Derek talked about an IDIQ, which is an indefinite delivery, indefinite quantity type contract with vendors on that contract where we award task orders. So while we're not, I can't say to you, well, we're going to have a lot of new opportunities in my area because we have a lot of IDIQs. It is important for you to find out who we're doing business with, and there are subcontracting opportunities that will continue as we go forth with these programs. Subcontracting with an existing government prime contractor is probably a very important thing for you to know and a very important thing for you to do to get started, because they know the rules, they know what we want, and they know how to prescribe things that we need to do going forward. We do encourage meetings with vendors and our program contract staff in an ongoing effort to broaden our knowledge of the vendor community and the innovations out there. But your goal today should not be to obtain as many names and numbers of CMS folks as you can. Remember, we work in a competitive environment where we give everybody a fair opportunity. We encourage ongoing communication with our vendors. Once they hold contracts, we want to continue to learn from each other to improve our business and our goals. We encourage your organization to do its homework. Take today to learn about our agency and not just about to market your organization. Ask about how we operate and learn about the conflicts of interest and the way our programs fit together so that you can make informed business decisions. One thing I want to point out to you, and I guess it's the way that pretty much I view myself, it's about communications, competition, and customer service. I know that it's got to be very frustrating for you to call the government or call someone here at CMS and not get the answers that you need. Very important question. So what I'm going to offer to you right now is if you have any questions in the areas that I just talked about, I would like you to call me personally. I will offer that up to you. I will listen to you. I will give you the answers that I can. And my number is 410-786-0203. Offering myself up as a resource because I think it's so important that you know what to do next. You have any individual questions, and I know a lot of this, you know, you ask around and you call and you don't get any guidance. You don't get any further than when you started to make the phone call. So please call me. I will speak to you and I will give you the information. I can't offer up the program offices to you. I can't even offer up my contract specialist because they're all busy and because they're all supporting different programs. But since I am at the head of that organization, I know all of that's going on within my group, and I can speak to you directly, and I feel that I can help you. Thank you, and I look forward to the rest of the day. After this session is over this morning, I will be available to start the process if you have any individual questions. One thing that I would like to point out to you, and I think that you need to understand this, is as we go through the contracting process, and I can throw the RFP and the RFQ and all the terms out there, all very confusing if you're new, but I can tell you, if there is a request for a proposal, and the proposal is in-house, and it is a full and open competition, nobody's going to talk to you about it. We go dark at that point. After we get the initial questions from the folks that actually want to know about the procurement, there is a process. If you submit a proposal to us, we probably have, I think within 10 days you can ask us questions. After that point, we go dark. We can't talk to you. But if you call me, I can tell you that. I can tell you why we can't talk to you or what's next. I can do that, and I will know what part of the process we're in. Now, I would like to introduce one of my division directors, Carol Seville, and she's going to talk to you about some specific opportunities that we may have within our group. Thank you.
Okay, good morning. As the shortest person, let me now play with the microphone. Good morning. My name is Carol Seville, and it's good to see a lot of you here today, and I recognize a lot of the faces, which is very promising, which means there are many businesses that have had success here at CMS, and you are staying on top of our ever-changing world because, as it was mentioned earlier this morning by Angela, it's not a one-time deal. Just because you did it one time doesn't mean forevermore you're here. So it is good to stay on top of our ever-changing world, and I hope that you will share your experiences with the other new vendors who are trying to get in the door. The very first thing I want to say is I'm a little bit concerned because Ed gave you his phone number, and yet he's on leave next week, so I'm anticipating many, many phone calls. I come with graphics. This is the face of government. This is what the face of government used to be. A little cardboard cutout that you'd call a 1-800 number and nobody would answer and nobody would help you. Today, this is the face of government. We're standing in front of you. We're in the hallway meeting with you. We have booths of vendors to help you. And it's all because, as Dan's earlier chart showed, because we want to hit our small business numbers, we want to improve competition, and we want to get the right goods and services for the American public. Plus, I like drawing and I like magic markers that smell pretty. Can we do my one? Because I'm not the IT person. I don't even touch it. Okay, so the teacher in me wants to give you a quiz. By the end of today, you should be able to answer all of these questions. And so I want you to look at the questions. I'll go through them real quickly. And look at the agenda for the afternoon sessions and place yourself accordingly. Everybody can't do everything. So figure out where your niche is and figure out where you want to be involved. There's a session this afternoon with program managers, and that will be run by Derek Hurd, and I'll be assisting in the facilitation of that. So if you want to learn about some of our major programs, bingo, that's the session for you. We did talk about 2 ways this morning that the agency doles out its money. I'm going to quiz you, because that one you've already heard the answer to, so I'm coming back to that one. I want to see a hand up. There will be a session this afternoon run by Lisa Bodway as the moderator for the good, the bad, and the ugly. What we want to see in proposals and the perspective from a vendor who is submitting proposals about how to submit an appropriate proposal. While I love the pretty color tabs and I take them out for my children's school projects, that's not what's going to make or break your proposal. So that is a really good session if you've never submitted anything to us before, or if you're an incumbent and you have some of the incumbency syndrome. It's good to stay on top of it and come back to the fold and listen to what we're looking for. There is a session this afternoon, I believe Jaime Galvez or maybe Brian Hebel is running it, on past performance. Why is past performance so important to us? And that's almost a basic question. When you hire somebody to paint your house, if they painted your dining room really rotten, are you bringing them back to paint your kitchen? No. So it's the same basic principle as you being somebody out in the marketplace. We're looking for past performance, a really valuable session for you to sit in on. Last but not least, there's a session that I believe Claude is running this afternoon on small businesses, and that will provide you with websites. We're all about reaching out and telling people, but you have to do some homework too. So we're going to provide you with links and sites for places where you can learn more about our agency, our programs, and how to have entree into our world of contracting. So that's my 2-second spiel, but now I want to see one hand up, and I'm looking right at John Soroka because I'm going to quiz him because I know him. Somebody tell me the 2 ways the agency doles out money. We listed 3 this morning. Dan listed them. One way. Why are you here today? One way that you want our money. Contracts. Thank you. What's the other way? No, put your hand down. Grants. Ding, ding, ding. So you're already 1 step ahead. You get 2 gold stars for the day, and I hope to see you in the hallway. Thank you. Oh, I apologize. The next speaker up is Don Cano. Don is the director of the IT group in OAGM. I apologize, Don.
I'm a little taller. Good morning. As Carol indicated, my name is Don Canode, and I am responsible for the IT contracts group. Within the group, we basically have responsibility for awarding and managing all of the IT contracts within the agency. I will say up front, there are a few exceptions to that where we have IT that's kind of so closely aligned with the program that it's remained within the program area of responsibility, but we have the predominance of IT throughout the agency. This morning, we're hoping to talk to you a little bit about some opportunities that are coming forward. These aren't all of the opportunities, but a few of the key opportunities that I think are starting this particular year that would be of interest to all the IT contractors. So we're going to talk about that. But up front, Derek had indicated that we have some agency-specific IDIQs, and in particular with the IT stuff, we have an IDIQ for virtual data centers. And so on that list, you'll see the holders of those contracts. So if you are involved with data center or hosting kinds of work, a lot of our data center work goes on our virtual data center. And we also have an enterprise systems development IDIQ. That IDIQ covers several functions, and we're going to be talking this morning a little bit to you, Andy Malmert, one of my division directors, about an upcoming procurement, which we're calling kind of ESD2. We actually currently on ESD do not have capability to compete small business opportunities. So we also look often to find GWACs, government-wide acquisition contracts that allow us to streamline and procure IT. GSA has several GWACs along with NIH NITAC that we use often to try to see if those are the right fit for our requirements and use those contracting vehicles. At times we may also look to GSA Schedule 70, and I guess if none of those are the options, we would move to potentially a full and open competition, but that would be pretty rare in the IT area because a lot of the requirements for IT are out there on these streamlined acquisition vehicles. First off, I'd like to talk a little bit about a particular upcoming opportunity within the group that's going to start this year and probably award in the first quarter of next year. It's for the HICS infrastructure and data center support. This particular requirement, we're estimating the solicitation to be issued this quarter. And again, as I indicated, that it would be awarded in the beginning of the next fiscal year. This procurement is anticipated to be an 8A set-aside. And I have from the program office, Steve Davidson, who I'm going to ask to come up and talk just a little bit about the requirements associated with this work.
Thank you, Don. I'm sort of in the middle, so I'll move this down. My name is Steve Davidson. I'm the Deputy Director of the Information Systems Group within the Centers for Clinical Standards and Quality. As Don mentioned, we do have an upcoming RFP coming out, and I'll just touch on a couple of the large areas of scope involved. First of all, there is infrastructure hosting, which involves a considerable amount of equipment that is government-owned equipment that would be needed to be managed and operated. Traditional data center operations, of course, and including production control of significant nature, and of course storage management and upgrades, patching, and everything else that goes with running a data center. There is a help desk component. It's primarily Tier 1 support. Involves credentialing users and answering questions and issues and problems they have accessing the CCSQ systems. Desktop support involves about 5,000 desktops scattered around the country at quality improvement organizations and ESRD networks. A couple of our other contractors also need to be supported in that regard. Performance testing is a huge part of what we do. The contractor would be required to perform stress testing and load testings of systems before they go into production. And finally, email support is a part of this procurement, supporting all the users of the HICS network and infrastructure. So we're looking forward to your responses, and I'll turn it back to Don.
Thanks, Steve. So I'm now going to turn it over to Andy Mulmer, one of the division directors in the IT contracts group, and he's going to talk a little bit about some other opportunities within the IT area.
Hey, thanks, Don. Good to see everybody. Thanks for coming today. I'm Andy Mummert. I have a division in OAGM, and I serve parts of OIS, the Office of Information Services. So we buy IT services for OIS. Let me talk about the Enterprise Systems Development 2. This is what we're working on right now to take place of the old ESD. Right now, we're in the middle of evaluating responses we got to the small business sources sought we released about a month ago. We have a lot. We have a lot. So what's going to happen is the results of that evaluation, that's going to shape the way small businesses are going to be included into this RFP. And right now it's too early to tell. I don't know what it's going to look like. We don't know yet. It's also too early to tell how long it's going to take us to go through this. So bear with me a little bit there. There's a new wrinkle this time. When we compete this RFP, there's some additional approvals we need to get outside of CMS. First time for us to do that. So we're not really sure what that's going to do to our schedule. So those two circumstances are going to combine to make it hard for us really to gauge now when we can hit the street with an RFP. But I'll commit, a la Ed, once we have a firmer idea, we'll go public with something. We'll put it on FedBiz, maybe we'll have a draft RFP, and we'll put it all out, and we'll have a better target date as to when the real RFP will hit the street, and you can start to build proposals towards it. The end goal with ESD2, we want to be able to award it in time to give us enough overlap with the old ESD so that we can move work off of the old vehicle in a more orderly fashion. You know, we don't want to be faced with having to cut over X number of task orders that we have on it on the old ESD all at once. So we're trying to give ourselves a little bit of some overlap between the ordering periods of the old contract and the new contract. So I know you wanted to hear what is it going to be and when is it going to be released. Sorry. But what we can do, we can tell you about the kinds of services we're thinking of that will be on it. And let me introduce Angela Hitchcock from the Office of Information Services. She runs the Division of Contracts and Procurement. She can talk about the kinds of services we're thinking of.
Good morning, everyone. I'm Angela Hitchcock within the Office of Information Services. Just wanted to say, I guess with the new ESD contract, what we're looking for is contractors with experience in some of the service areas that I'm going to talk about in a second. And we're looking for contractors to work collaboratively with us and with each other. So just wanted to kind of say that. And I'll quickly outline some of the services that are going to be included in the scope of the new ESD. What we're looking for is a more flexible model. Like Andy said, we don't really know what the model is going to look like because we're still doing our market research. But what we're looking for is to be able to align our task orders by business need, not necessarily by phases of the systems development lifecycle, which is the way the current ESD is structured. But basically, the new SD is going to still continue to have the services in the systems development lifecycle, initiation and concept and planning services, requirement services, which is basically a build from that initiation phase, the design services, which supports the activities of designing a large-scale system, development services, which is basically the development of security, self-assessments, fixing code, correcting procedures, and building defects, testing services, which involves the gamut of all different types of testing, formal testing services that covers the validation of software and system components developed or modified in other tasks. Maintenance, which involves the maintenance of the system code in the production environment. It covers fixes and small-scale enhancements. And then there will be a phase for ESD support services, which is user documentation, user training, product management services, and business operation services. We also have data request services, which includes gathering and propagating data for all of our CMS internal and external customers. And we're also going to have security controls and assessments, which consist of the testing of applications produced in-house, includes building test plans for the testing and evaluation of our systems, and also independent validation and verification services. So with that, I will turn it back over to Andy.
Thanks, Angela. So I do have a couple updates on the, we're running some task orders right now. Medicare Advantage, MAPD, and the MBD, EDB work. That is, we're doing those under the old ESD contract. We have draft RFPs out now for that. We're trying to get the real RFP issued next Friday, February 7th. The last one, the Enterprise Architecture Support Services, we're also trying to release that RFP next Friday, the 7th. We have a draft out right now. We're doing that under the NIH CIOSP 3 Small Business GWAC, and I believe we're doing that as an 8A set-aside. So there's a draft out for that, so that's how we can play on those. Look for the RFP next Friday. So that's my update on our stuff. Next up is Brian Hebel from the Quality Improvement Contracts area.
Good morning, good morning. Thank you all for coming today. It's great to see the room filled in our second industry day. And today's my lucky day today because I'm going to be at the microphone twice today. And I'm going to have more fun than watching American Idol. I tell you, it's going to be a great day. So I have two topics I want to cover today. But before I do, is there anybody here from Atlanta? We have one, two hands from Atlanta. I mean, that came from Atlanta, not born in Atlanta. Came from. We have two hands. You guys get the gold star today for coming. I'm sure it was a tough commute. Thank you for being here. So I just want to, my name is Brian Hebel, and I'm a division director in the Division of Quality Contracts in the Acquisition Support Group. And I'm going to actually have two topics that I'm covering today. The first topic today is acquisitions that are taking place in my division. And the second topic, I'm going to pitch my 10:45 to 11:30 session, and it's contractors' perspectives on contracting. And we're going to have three of your industry colleagues up on stage, and we're going to ask and debate some questions on their perspective on contracting. And I just want to let you know, before you leave, if you come to my presentation, you're going to learn three things. I guarantee you're going to learn three things about contracting. Angela Billups mentioned one of them today. When you leave, I guarantee you'll learn three things that you didn't know. So I hope you will come and participate, and we're going to have a fun time at 10:30. So that's my pitch. And we're going to talk about how you can be strategic, be the difference, be connected, and be responsive to meeting the government's needs. Actually, my division this year is very, very busy. We have lots of work coming up, and there's some reasons for that. Actually, the work in our division really is quality improvement program work, including the beneficiary family-centered care solicitation that was released in December, the Quality Improvement Network contract solicitation that was also released in September, and we have a contract that we awarded last year. It was an $800 million ceiling IDIQ contract, and that was the Measure Instrument Development Support contract. And we also have some other ongoing contract work that I want to talk about today. So the Quality Improvement Organization work, it's changed very drastically this year. The program was enacted in 1984, and you can find it in sections 1151 through 1162 2 of the Social Security Act. And we went through 10 cycles of contracts, and the way that legislation was written, if the contracts performed satisfactorily, we could renew their contract every 3 years. However, the legislation that came out in 2011, which was the trade bill, it's known as Public Law 11240, that allowed us to make some significant changes to the program here at CMS. And it's gone through some major changes as a result of that legislation. So we're competing all the contracts, all 53, and we've actually broken apart 2 parts of that program, and part of that was case review work, and the other one was quality improvement work. And for the beneficiary-centered care solicitation that I mentioned, it was released on December 5th. The purpose of that contract is to have contractors perform quality of care reviews of medical records, perform Medicare beneficiary complaint reviews, review discharge and terminations and service appeals in various provider settings, perform Medicare beneficiary and medical necessity reviews, and emergency treatment and active labor act reviews. And proposals were received on that one already, and we're anticipating a award date of May 15th. The other solicitation that we released in December is the Quality Innovation Network solicitation. And the requirements in this, the proposals for this are due on February 21st. And the requirements in this solicitation include initiating quality of care projects. And the way we're doing this, it's going to be an IDIQ contract, and we're going to have a task order in every state. And the task orders are designed to improving the health status in communities, making care safer by reducing harm caused in the delivery of care, promoting effective communication and coordination of care, and making care more affordable. In addition to that, and in support of that program, we have some other contracts that we are going to be releasing, that we hope to release this year. 5 of these initiatives are part of the Value Incentives and Quality Reporting Program, and will be released through the MIDS contract. And 2 other initiatives include an Independent Evaluation Center contract and a Program Collaboration Center contract. And we're actually anticipating our acquisition strategy is do that through the Armada IQ contract that will be awarded later this year. Right now, there's 3 other initiatives related to this program that we're hoping to release later this year, and they include the Beneficiary Family-Centered Solicitation National Coordinating Center contract, the Quality Innovative Network National Coordinating Center solicitation, and the Beneficiary Family-Centered Care Oversight and Review Center contract. And you'll hear more of those in the next couple months. And they'll be 5-year contracts. And finally, and the contract that I mentioned that we awarded last year was the $800 million IDIQ contract for the Measurement Instrument Development Support contract. We're anticipating actually 26 competitive task orders on that contract this year. We awarded 3 contracts last year at the end of the fiscal year that were part of the competition, the initial competition. Most of those task orders will have a base year and 5-year options. And that's pretty much it in my area. So with that said, I hope you come at 10:45. It'll be a great presentation, and we will be having engaging questions with your colleagues. So thank you, and thank you for coming.
So thank you, everybody. I hope we couldn't possibly talk about the 4,500 or so contract actions that we have every year, but the purpose was to sort of just whet your appetite a little bit for those of you who aren't familiar with some of the work that goes on here. So the next 15 minutes, because this is a request that you all had at the last meeting, is not enough interaction with sort of speakers. So the next 15 minutes is sort of open for whatever questions you have. I'll try to moderate those questions with the speakers that we have up front here. I think there are microphones floating around, so if you want to ask a question, I would ask you just to sort of stand up and somebody will come to you with a microphone. So while you're thinking about asking your question, I will say next we're going to have a break after this, and then the next session start. There's one session here in the auditorium that Brian just talked about, And there's another session, you'll see it says C112. That's down sort of the way you came in through the atrium foyer area, and there's a hallway. There'll be people to guide you to those sessions if you want to participate in that session. So any questions about anything you heard this morning? Somebody. There we go, up here and right here. So here we go. You got a microphone. So whoever gets the microphone first, that's how this works.
Okay. Hi, Dan. I'm Brenda Bearden.
Hi.
And one of the things that contractors always like to know about from leaders in government is, where is your Achilles heel issue today? What is it that bugs you the most, so that we can frame our minds about how to be helpful to you?
Right. So Angela sort of referred to this a little bit in her talk about the interaction with program managers and the interaction with contracting staff. So this might sound like a really simple thing to you, but one of the things we're doing this year, there's a desire throughout CMS with the 1,000 contracting cores that we have, with the managers, we got group directors, office directors, we got a lot of people involved in acquisition. And if you contract with CMS, you'll know that our contractors need to work together, because there's a lot of work that they do where they rely on one another. So what I worry about a lot, and I think there's something that we need to work on, is just defining roles and responsibilities of staff within the government. Who, if you're a contractor, who do you talk to about what? Where do I turn to? As Ed alluded to earlier, sometimes it's hard to get answers to simple questions. So I worry about making sure everybody understands, and it's never going to be perfect, I get that, but I worry about making sure that you all understand who has what responsibility and what authority, right? Oh, my core is asking me to do this, and their division director is asking me to do this, and this leader in CMS is asking me to do that, and this other contractor I'm working with, what am I supposed to be doing here, right? So of course we always say the contract is what rules. Is it in the contract? And that's sort of the job of the contracting officer. Get all those people together to understand, what is it that you're supposed to be working on? Where are you supposed to be, going? Angela referred to that one contractor that didn't work out. My guess is, if I had to guess, that contractor, they had no idea what was in their contract. And so that's what I worry about, because you get the contract, you start working, you want to do good work, you're having coffee with Joe at Panera, and he's telling you you're doing a good job, maybe for the wrong reasons. Maybe it's not because of what's really in your contract and where you're supposed to be headed. So anyway, that's what I worry about at night, and that's some of the things that we're going to be working on here at CMS. By the way, love to hear from you, as sort of if you think that's even true or not true, if that's a worry to you or not, because I hear that it is from time to time, at least from where I sit. So thanks for the question. And we had another question over here, a couple of them.
Thanks. Hi, I'm Jonathan Villette with One World Communications and Advertising Agency in San Francisco. One of the speakers mentioned the importance of a small business identifying the large businesses before they make their bids to perhaps subcontract be considered. Can you give us some guidance on how to identify those large businesses?
So one of the things, Derek talked about our IDIQ contractors. By the way, we've been trying to do this for a long time, and for those that are familiar with CMS, it's taken a while, but we're going to be having the list of IDIQ contractors. So we have a contract, for instance, our outreach and education, advertising-like efforts with the Office of Communications. You'll see a list of the contractors, who they are, contact information, at least from our staff, who can help provide you. We always have to be a little sensitive about handing out names, and you all can sort of figure out who you need to talk to. But so that's one way, the IDIQ list. The other way is if there's ever anything competitive on the Federal Business Opportunity website, I believe there are ways that you can put your name, your company contact information. Angela's shaking her head, so because obviously I don't do that, but I've heard, right, you can do this. So you can go in there and you can put your small business name, and the businesses that are interested in bidding on that can contact you for support and subcontracting opportunities.
Hi, good morning. My name is Mavis O'Neill. I'm with IBM. Dan, you
Hi.
can give out my name, Denny Small Business.
Small business.
That you'd like.
Familiar face.
So I have a question for Dr. Billups, if that's okay. I don't
Yeah.
know if she wants to answer it from the seat or not. But, you know, President Obama is making a real hard push to raising the minimum wage for federal employees. And I'm wondering, with the 1010 initiative that he's working on, how does that affect what you folks have done historically and in the future? I mean, are we going to see a change in wage determination? How do you think that will be affected, Dr. Billups?
I'm glad you asked her that question.
Well, we want to make sure we
Are you
comply.
referring to the most recent executive order
That's
that
right,
came
ma'am.
out with
Yes.
asking the federal contractors
Oh.
to pay their employees?
Yes, ma'am.
Because it's a little different from what you described.
Okay, sorry. That is what I was talking about.
And so for everybody, there was an executive order that was signed this week, and it was part of the President's State of the Union address. And of course, we got advance notice to say it's there, what are you doing, how are you going to do it, whatever. But anyway, I read through some of it earlier this week. I had to read through some of it yesterday because we had to answer some questions for the Secretary. But basically what the gist of the executive order is that if you have a service contract with the government that the Service Contract Act is applicable to, or Davis-Bacon, or if you have if you're a contractor that provide concessionaire services, you're required to pay, the minimum wage that you're required to pay is $10.10. And I don't know what the current minimum wage is, but the new minimum wage for federal contracts, which would be effective October 2014, would be $10.10. Now, the way that we have to work with the Department of Labor, of course, to kind of figure out how we're going to make sure that the wage determinations are updated to reflect that information. Some of the things that we're doing at the department to kind of figure out what the impact is on the current contracts that we have. We're looking at those contracts that may have Davis-Bacon Act as well as the Service Contract Act to see where the contracts are right now, that there may be an impact, looking at what the budget impact would be, because of course if the contracts that were already awarded, we did not anticipate this increase in the salaries that we have to pay, that you ultimately, that you pay, first. So there are a lot of things that's going on in this space, and because it just came out this week, and like I said, when we first heard about it, it was something about it would be effective immediately, and we said, can't work. So what I read that actually came out in the executive order that was signed, and I did read this just yesterday, it is effective October 1st of this year. But basically what the impact would be, we're going to try to work through the wage determinations, the Davis-Bacon Act, and make sure that you know what that is. But we will have some type of insight probably by the end of next month of how that is impacting current contracts at HHS.
Thank you. So I'm going to turn this around a minute because that's a great question. So just because you're all here and I can ask the question, so show of hands, raising that to 10/10 October 2014, how many of you think that's going to increase your contract costs? Raise your hand. Not many? Hardly anybody? Interesting. Okay.
Hi, Dan. Lisa Weiss.
Hello.
You don't stay awake at night wondering who's going to win the game this weekend?
Not this year, last year.
Yeah, last year. There you go, last year. Somebody asked you a question earlier about what keeps you awake at night. And I sympathize and wish you well in working on improving the coordination between contracts and programs. And, that's sort of been a challenge since the beginning of time. I'd encourage you to probably bring the Corps into the loop, and that might help sort of that overall process. But good luck with that. I just wondered more, that seemed to me like an internal management priority. And I guess I'd turn the question and ask, it's from an external, whether it's public policy, whether it's politics, do things like organizational conflict of interest, do those sort, your accountabilities that you have as a contracting officer, do those continue to be priorities for you?
Yes. So we have lots of, so that's a great question. I got this question about the number one thing that worries me. There's lots of things that worry me every night. But we'll continue to focus on organizational conflict of interest. For those of you who don't know, we have an internal strategic plan. We have 19 initiatives that we're working on one year. defining roles and responsibilities is one of them. We have a lot of other things that we do where we want to make sure that we're retaining and attracting the best people that we can have to support you all in the area. We're looking at policies and processes. We're looking at things like writing requirements. So there's a lot of initiatives that we have within our office that try to make improvements in sort of what we do that support you and our customers within CMS. Any other questions? There we go, over here. Right, so for the ESD, I'll try to answer this. Andy and Don will keep me straight. So, by the way, if you're a small business, you want to become a large business and bought by the large business, get on the ESD. Right? So that's what's happened to us. As most of you know, a lot of our small businesses have been bought up by large businesses. So there's not really, maybe we have one, but you can't really compete with just one. So anytime we have work within that falls within the purview of ESD, we could just go to the large, but we do a lot of work working with small businesses to try to determine what vehicle do we go to. Yes, we do use the NIH CIOSP 3, I think the 8A portion of that. There's another 8A stars, I think, right, that maybe we'll use that from time to time. Not lots and lots, not like 20s and 30s, like under a dozen of those, I would say, maybe a year. But each, I wish I had a sort of a standard answer for you, but my standard answer is each acquisition stands on its own. That's why we do sources sought, we do market research, we try really hard to do the right kind of market research to see, what vehicles are out there, what kind of businesses are out there that can offer the kind of services that we need. Eventually, as Andy said, we don't really know what ESD2 will look like and what part of that will be set aside for small, but we're working with Claude and the small business people here at CMS to try to, and our program offices to try to determine, what is it that we can set aside for small businesses. Oh. So we have tried other GWACs. I think we used GSA Alliant on our high glass procurement last year as sort of a test to see what other vehicles were like. It was sort of a different model. We'll continue to, again, look at every procurement on its own, and there may be times when ESD isn't appropriate. There's lots of reasons that go into us looking at the market research that comes in, looking what our requirement is, looking where this thing is going. Maybe these aren't the right kind of companies. So, it's not, ESD isn't the only place we're going to go to for competitions in the future, I'll say. Probably the majority will, but not all. Anything else? Right up here. Oh, of course, Kathy.
If you could, thank you. If you could explain a little bit about interacting with your contracting officer team. Many times during the procurement process, either prior to an RFP release, during or after, there's communications between the contracting organization and industry on requirements, but things change. Mm-hmm. And sometimes things change that impact the vendor side, and a lot of the discussions out is nobody wants to call the contracting officer because they're afraid it'll taint them in a negative way if you're pointing out something that is impacting them in a negative way and you're asking for a change. Right. So I guess the question I'm asking, and really for I'd like a lot of people in this room that I've had these conversations with to hear this, is what is the process that you see as beneficial to you on how, when you see something, a decision that's being made that you think can impact in a negative way the industry side, which will eventually, because they're bidding, impact your bids. What's the proper process to go through to point that out in a helpful way, a collaborative way, and not a, hey, I just want to tell you where you did something wrong.
Right. So my short answer is contact the appropriate division director in OAGM. I know Ed's willing to take all the calls in his group, but I mean, I have a lot of confidence in my division directors, and they know a lot about their programs. Sometimes they know more about their programs than the program offices know about their programs. So, let me just say, it's the reason why a lot of times you might call your contracting officer or contract specialist and they say, I can't answer that question, right? We have a lot of new people. We have a lot of people that have only been here a couple years, right? And, you know, we're all type A. We want to do things by the regs. And they're a little nervous about answering the questions and giving the wrong answer and steering you in the wrong direction. So we're trying to do some things to change that so that at the working level, specialists and COs are answering questions when they can. But my division directors, they know what they can say and what they can't say, and they understand that we're a customer service organization, and they'll reach out to the program office like Angela here and say, hey, I got a call from Kathy about this. What do you think about that? And they'll get back to you. So that would be my short answer to call your appropriate division director. By the way, that's one of the reasons why they're up here today talking to you, some of them, division group directors. So you get to know who they are and that you can communicate with them. And if you don't know who they are, you can get that information by, I think, looking on our external website.
Hi, Dan. Amy Tong, Strategy Consulting. I represent a small business. I'd like to dovetail on the question about ESD2. So during Andy's segment, he mentioned for the first time approval outside of CMS is required for EDS2. Is that EDS2 specific, or is that applied to large procurements at CMS as a whole?
So there's September 2011, there was a new OFPP directive that anytime an agency wants to do an IDIQ like ESD2, where other agencies across the government offer similar types of services, you have to put together a business case. So we've worked with Angela and the department, and we have put that business case together. We've posted that publicly to other agencies. We've gotten comments back. We're pretty far through that, but I think what Andy was saying, this is sort of the first time we've done this. We haven't really gotten total approval to do that yet. We think that we will. Angela's sitting here, so I can say that. We think we'll sort of be able to move forward with that. But it's just another hoop that we have to sort of jump through. We don't expect it to be a big roadblock, but it's just an unknown for us right now. Yeah. So any last question? Coming up on time, and I'd like to keep you all, get you to the cafeteria to get coffee.
Hi, my name is John Ambelang. I work at Wisconsin Physician Service. One of the MACs on your map. I have a logistical question. This seems to be a meeting to allow us to do business with you easier. Sometimes producing large numbers of hard copies and submitting them, creates a barrier for small businesses and large businesses alike. Is CMS considering accepting more electronic submissions through some of the new technologies that are available?
So I'm going to look at Linda because you're a MAC. And, I hate to say it this way, but different program offices have different requirements for different reasons. And I don't know if there is one in particular for the MACs to have lots of copies of hard copies of proposals or not. I know on other procurements we get a lot of just electronic proposals, period, and we hand them out. But people still like, when it comes to proposals, people still like that paper. It's somewhat of a cultural thing. But I don't know, Linda, if you have anything to add to that about the MAC program in general.
Okay, so the MAC program in general, we have moved pretty much to all electronic files. When we do our full and open procurements, we are trying to receive electronic proposals. There are some cases where we're asking for a hard copy or two because we do have some of those folks that, when they're reviewing proposals, still need to touch that paper. But we are trying to move to a total electronic receipt of proposals. So, and that should also be going on in the contract administration world too, on the MAC contracts. So when we're doing modifications to your contracts, we should not be asking for paper. I think where we may still be asking for some paper, maybe in the pre-award environment when we're doing a competition, because we have a lot of folks that need to see the proposals. Some of them still feel compelled to touch that paper. We're trying to push them away from that and say you can hit the button and print what you need. So we are really working to become fully electronic in my area.
Thank you. So I'm going to let you go, but just so you know, at 15 minutes, 10:45 or so, in here we're going to talk about contractors' perspective on contracting. Brian's going to run that panel for us, and then across the way, we're going to, for those of you who kind of are our current contractors, so you sort of see a laundry list, HIPAA, some current sort of things that we put in our contract provisions. HIPAA, about our invoices, FOIA, HSPD 12, 80 compliance. There's a lot of things that we stick into your contracts, and hopefully Lisa Bodway is going to be able to shed some light on some of that, along with some of our ethics staff. So thank you for coming.